And you. Sorry about the technical issues.
And we're live. Welcome everybody to the Men's Health Week at the Virtual Village Hall. I hope you've been enjoying all the events. They roll along smoothly as a swan, but beneath the surface there's a lot of rushing and panicking going on, I can tell you. My name's Jim Pollard from the Men's Health Forum, and I'm delighted to be joined this morning by Dr. Hilary Jones, MBE, GP, author and medical broadcaster, and we're going to be doing some man talk. Welcome, Dr. Hilary. Thank you for joining us today from the bowels of the ITV car park, I believe.
Yeah, well, I'm in the loading dock because we had some technical issues here today, but improvisation is absolutely fine. I haven't even told the security officer I've nicked her chair, but that's what life is like. I've got your chair, and we're very happy to do it from anywhere. I mean, the thing about this, Jim, about talking about men's health is, you know, men don't like to go to surgeries and see doctors. They don't like clinics. They don't like hospitals. They like to talk about their health in the pub or in the changing room at the sports club. So what better than the ITV loading dock to continue this conversation?
Fantastic. I just hope security aren't going to kick you out.
Fingers crossed.
So we're going to be chatting about some of the common men's health challenges that affect men. And you can ask Dr. Hilary questions in the chat if you like, and we'll try and get through as many of those as we can. And there's also a feature called Slido, which I think you can read about on the screen, which enables you to ask questions anonymously if you prefer to do that. So we'll just kick off. We'll keep an eye out for your questions, and we'll see how it goes. So, Hilary, what are the, I suppose a really sort of massive question, but one to sort of kick it off. What are the kind of main health problems that men should be looking out for? I know that the big three killers of men are heart disease, cancer, and suicide, unfortunately. Perhaps you can just say a bit more, sort of put it the big picture really around men's health.
Yeah, absolutely. So currently, probably the main cause of death in men would be heart disease and cancers. And as we all live longer, obviously these things are more likely to happen. But there is so much we could do to prevent premature illness and suffering. I mean, prostate cancer is at the fore. We talk more and more about screening for prostate cancer, but that's quite a complex area. And many men will have, they'll die with prostate cancer, but not die of it, because for many men, as they get older, there will be changes in their prostate gland, some of which can be cancerous, but they won't die of it. In younger men, sometimes it's a more aggressive type of cancer, and that certainly does need to be picked up as early as possible. But heart disease is common because cholesterol levels can be high. Obesity is a big problem in the UK right now, with 2/3 of people either overweight or obese. And that can lead on to diabetes, which predisposes to heart disease as well. So the other thing you mentioned was suicide, and mental health has taken a real pounding in both men and women since the pandemic. And men do find it harder to open up about their emotions and their feelings. And that's why suicide is still the commonest cause of death in men under the age of 40. And we still see too many suicides, men who bottle their emotions up and still feel that, you know, it's strong not to admit to any problems. So I think all these three things are worth exploring. And all the other things as well, testicular cancer in younger men, and all of the anxiety and depression and stress that we see in modern day life.
Thanks, Hilary. So, I mean, anybody out there with questions on any of those topics or others, really, I mean, that's what we're inviting you to talk about, anything you like. As a man goes through his life, do you think we should be sort of checking ourselves, maybe checking our testicles or whatever, or other things as we go through life? Are there different things we should check at different ages in our life, or is it more about being generally aware of your body in a way?
Yeah, I mean, I think it's very important to be generally aware, but there are certain things which are more common at certain ages. So for example, younger men are much more likely to develop testicular cancer. So all men should be aware of the shape, texture, size of their testicles and look for any changes. The size of the testicles are not the left one isn't always going to be the same size as the right one. That's perfectly normal. One will hang lower than the other. It's quite common to notice lumps and bumps, but what is important is to look for anything new, anything that's changed. And sometimes it's the female partner that notices a difference. It's testicular cancer is often a painless condition, so the lump may not be uncomfortable for some time. But anything that's out of the ordinary, it's really important to go and talk to your doctor about that if you've noticed anything. Usually a lump in the scrotum is going to be a cyst or a hydrocele, which is a collection of fluid, completely benign in both instances. But it's important to exclude that rare one, which is testicular cancer. So for younger men, that's key. Also, as we get older, we'll experience changes. So after the age of 30, 40, it's important to get blood pressure checked and cholesterol levels checked. Routine every 5 years after 40, tests for diabetes, so testing for the presence of sugar in the urine. As I say, blood pressure, height and weight ratios, body mass index. All of these things are often presenting with asymptomatic changes. So you wouldn't necessarily notice that your cholesterol is high. You wouldn't notice that your blood pressure was high. Just like you wouldn't notice if you had glaucoma until you had tunnel vision. It was far too late to do much about it. So having checkups is a really good idea. And if you don't do it for yourself, as many men don't, do it for your family. Do it for your partner, your children. They want you to stay healthy. And you want to stay healthy for them, if not for yourself. So, use the availability of screening procedures and clinics and doctors who are approachable, I hope, these days, and friendly and welcoming, and they won't make you feel embarrassed or awkward.
Before the pandemic, the NHS had got really good, I think, at inviting people in for a health check in their 40s. But from what I hear, it's not started up again everywhere since. And I'm guessing you sort of share my concern about that, really, because those NHS health checks are really important for those symptomless things that you're talking about.
That's right. I mean, it's important, Jim, to realise that whilst the NHS is under pressure, it's still working. And, we're using nurse practitioners more and more to do what GPs used to be doing. So nurse practitioners are excellent at doing these screening tests and, just talking to guys about their health and their concerns. I mean, for example, a health screening that you go to for physical changes, for example, looking for sugar in the urine or protein or blood in the urine, checking blood pressure, checking cholesterol. It's important to use it as an opportunity to chat. Have you got any concerns? Have you noticed anything? Most people will have some concerns about something, whether it's related to what your parents suffered from or what a friend has had recently or what you've noticed that's different. And very often reassurance is so much of a relief to people when they hear that, oh, what you've noticed is actually normal. And if it isn't, get it sorted. If you just ignore symptoms, they're going to get worse usually. And they could be a harbinger of something more sinister that is readily treatable. So I would say, as well as, talking to your mates in the changing room at the sports club or in the bar, then talk to your GP, talk to your doctor as a mate. We don't mind if you don't know the technical terms, the medical terms. Use blokish terms if you like, and just come out with it and tell us what you're worried about.
I think you've raised a really interesting point there, because I think one thing we can talk a little bit about maybe why men are reluctant to go to GPs. And one of those things is I think sometimes we don't really know enough about our health to ask the right questions, and we feel a bit stupid and that puts us off going to the doctor.
But we shouldn't. We're human beings, us doctors, believe it or not. So in the same way that we don't know anything about plumbing or electrical circuits, and we feel stupid talking to the electrician about why our fuses keep blowing, it's the same for people coming to us. it's our job to explain to people, what's going on. And we want people to use the language that they're familiar with. So, we don't talk about motions and feces, we talk about poo. People talk about poo and pee, and that's the language of society. So use the language that you're familiar with. Don't worry about trying to impress your doctor. We've seen it all before. It's all bread and butter to us, and hopefully we're there to put you at your ease.
What do you think's behind the reluctance that we see in men sometimes to come forward with what's concerning them?
Well, I think traditionally it's always been this sort of province of mothers to look after our health when we're children. So we take our problems to mummy, and then mummy takes us to the doctor. So that's the first thing. It's women who are health conscious, and then when we get as far as the doctor's surgery, we feel a little bit sort of on the other side of the desk. We feel that the doctor's got all the power and we haven't. We feel a bit silly. In the playground, we start to hear those puerile jokes, which have usually got and those sort of messages which are completely erroneous, which we have no way of correcting. We get embarrassed in adolescence about sex and puberty and development. And then it is almost a societal thing that to make a fuss about our health or complain about our health is rather effeminate and weak. And actually, it's strong to be able to express our emotions. But we're brought up with this idea that real men don't cry, and that it's strong and masculine not to complain. But that's why so many men literally die of embarrassment. Because if they've got prostate problems and they ignore them, 1 in 10 men with an enlarged prostate might have a cancer. And unfortunately, some aggressive prostate cancers will kill men even in their 40s and 50s. So, I think it's time that men grew up, took responsibility for their own health, and were quite open about any symptoms that are new for them.
I'm just wondering so there is a demand issue. Obviously, we need to encourage men to demand more and go and see their doctor. But there is a kind of supply side issue as well, I think. I mean, the 8 a.m. scramble to get a GP appointment is really difficult if that's the time when you're traveling to work. And obviously, men are far more likely to be working full time than women. So they're far less likely to have the opportunity to sort of make that really important phone call 2 seconds before somebody else does at 8 o'clock in the morning.
Yeah, it's absolutely true. It is very difficult to access general practice appointments these days, but it's important that we are assertive and we keep trying. I'm pretty sure that men who can prioritise a ticket for the Champions League in Istanbul and get one can bother to stay on the phone for a few minutes and try and get an appointment with a GP. And often that appointment will be a video consultation. It might not necessitate a visit down to the GP surgery. But I think it's time we put our health as priority. Make sure we get that appointment, even if you're getting your partner to get the appointment for you, or even your secretary, dare I say it. But yeah, get that appointment. They are available. They might be harder to get at the moment, but you will get one. And if you've got an issue, get it sorted.
Would you like to see GPs do a little bit more on opening hours? I mean, my GP they're great, but they're only open between 9 and 6. And again, if you're working full time, it suddenly becomes a bit more difficult. So I take calls from them during work. I'm lucky because of what I do, but not everyone's able to do that.
Yes, I mean, GP general practice has changed. And when I first started in general practice, I ran my own list. We had surgeries, 2 or 3 surgeries a day. We had appointments available every day, as well as the routine appointments. We would see emergencies. We would have Saturday morning surgeries, and we would do house calls. And it has changed to some extent. And staggered surgeries would be a very good idea. So a morning surgery at 8 o'clock, one in the late morning, early afternoon. If you've got a partnership, that should be possible. I think what a lot of people forget is that GPs don't just see face-to-face consults, they do a lot of other work as well. So they're visiting care homes and seeing residents there. They're doing a lot of administrative and paperwork. They're writing prescriptions. I mean, an average GP might write out and check 60, 70 prescriptions every day, which they have to sign, and they take responsibility for getting those medicines right. So it's not just about the time they spend face-to-face with patients, it's about all the other work they do. And they cram a lot into that 9 to 6 or that 8 to 7 or whatever it is. And I can tell you, having done lots of different jobs in my life, that it is one of the hardest jobs in the world to do. Lots of responsibility, and painstaking care to make sure that we look after our patients as well as we can.
Yeah, no, I don't doubt that. We also support our doctors. I think it's a very hard job to do in any time, and at the moment it must be particularly difficult. Just kind of coming back to those checks, because someone's asked us a question. Hi, Dr. Hilary. What are your thoughts on hormone health, and should men be having their hormones checked? I'm guessing that talking about testosterone levels and what we sometimes hear called the andropause.
Yes, and it's quite a controversial subject. If you look at men's testosterone levels, they hardly change between puberty and the age of 70, 75. Some doctors argue that whilst testosterone levels generally stay pretty stable, that the receptor sites on our cells which respond to those hormones become less sensitive. So normal hormone levels doesn't mean to say that we respond the same way to them. So that's one argument for why men of a certain age go through what they call a viropause, male menopause, if you like. So they feel tired, they feel a little bit depressed sometimes, not able to cope so much. Hypogonadism is the phrase we use for people with proven low testosterone levels. And I was recently on a program with Sir Stephen Redgrave talking about his low testosterone. Would you believe it? A 5 times or whatever gold medal Olympian, talking about low testosterone levels and how it affected his diabetes. So I think if men in their late 40s, 50s start to feel low in mood, tired, and generally under the weather, it's certainly worth not just assuming that it's midlife and you're getting older. It's worth exploring the possibility that you could have low testosterone levels and getting a simple blood test done to check that, amongst other things.
There could be, of course, other causes of it, couldn't there? I mean, rather than just low testosterone.
Oh, absolutely. I mean, fatigue is you name it. It's over 200 causes of fatigue. So it could be depression. It could be just poor quality sleep. It could be an underactive thyroid. It could be diabetes. And that's what we do as doctors. We investigate like detectives. We investigate a set of symptoms and find out what's causing it so that we can address it appropriately.
Are you concerned about, I mean, there's certainly a lot of this available in private practice, isn't there? Testosterone replacement and everything. Are you concerned that maybe people are sort of focusing on that and not looking at maybe some of the other causes? Maybe rather than having testosterone replacement therapy, a man should be sort of focusing on improving his relationship with his wife. That might be what's making him depressed. For sure.
I mean, men tend to talk about things in concrete terms. So, if for example, if we raise the subject of erectile dysfunction, people think, right, it's a physical thing. As we get older, the circulation isn't as good, or the nervous system isn't as good. But what about your relationship? Is it a global failure to obtain an erection, so that it would occur at any time, or is it your relationship? Is the desire gone? And those are the sort of fundamental questions that need to be explored before people resort to taking medication. Yeah. So it's easy to reach for a pill for this and a pill for that, the panacea for all things, but actually getting to the root of the problem, distinguishing between a depression caused by psychological issues and a fatigue caused by an underactive thyroid or diabetes. Very important to get that sorted out.
Yeah, I'm really glad you've raised the topic of erectile dysfunction, because men don't talk about that often enough either. Because it's a marker of a number of things, isn't it? Not just possibly depression and relationship problems, but of health, other health, heart health problems, or diabetes, or whatever.
Sorry, I just lost you for a moment there.
Yeah,
Can you repeat that?
I wondered we'd lost you there. I was just talking about what erection problems can be a sign of, the other health conditions such as heart disease, diabetes, and so on.
Yeah. Certainly in an older age group, it's often a physical cause. So, we need a blood supply to get into the hollow chambers within the penis, and that requires a functioning nervous system and a good circulatory system. And sometimes erectile dysfunction that is a frequent problem can be the first sign of heart disease, because the arteries that affect your penis can affect your heart, and other blood vessels as well. So it's always worth getting it checked out before you start taking medication, so that you're not masking, so that the problem isn't being masked by medicines when you've got an underlying heart problem, for example. In younger men, there's often a psychological cause for the erectile dysfunction. So performance anxiety, if too much is expected in bed of a young man, then that can cause anxiety, which is particularly counterproductive to achieving what you want to achieve in bed. Another problem is addiction to pornography, and a lot of men find that if they're watching a lot of pornography, that they've got these unrealistic expectations which they can't possibly match. It's a fantasy in many instances. So there are psychological reasons and physical reasons, sometimes a combination of both. And again, it's important to explore the root cause of these problems and go from there.
I'm just going to put in a little plug for a new publication from the Men's Health Forum on that topic, Hilary. We've noticed that porn has become the second most common addiction for which men are seeking professional help, so second only to alcohol. And we've produced a publication about that, because there isn't really much out there. So just everybody who is listening, if you look on the Men's Health Forum website and all the stuff around Men's Health Week, which obviously this is part of, you'll find some links to that publication, which is useful for men of all ages, I think.
Yeah, no, absolutely. It's something that is a growing problem, very prevalent, and it can cause quite a lot of damage as well.
Are you seeing more young men coming forward with this problem?
To be honest, no, because they're often reluctant to talk about it and to admit to that kind of addiction.
Yeah.
I mean, any addiction is something that is often a hidden problem, whether it's gambling or alcohol, tobacco. People are pretty reluctant to talk about it. That they feel a sense of shame and guilt, and addiction to pornography is no different. I would hope that changes, and that people do recognise doctors and nurses as people that they can trust in and go to and seek help. And obviously talking about it is the first step for anybody with any kind of addiction.
We've also produced something on gambling as well for similar reasons. It's just another one of these addictions which particularly affects men, which just seems to have been fueled by 24/7 internet access.
Yeah, absolutely. And addiction to social media is another problem, particularly in younger guys. We all know that of the 100 messages we might receive, we don't read the 99 nice comments. We only read and reread the nasty one.
Yeah.
And that's the problem with social media. It can be very damaging to one's psyche, one's self-esteem. And again, it's well worth trying to be disciplined enough to limit one's time on social media to so much time a day and not too much. Real relationship, face-to-face, is important for me.
Very difficult for young people, isn't it, who almost kind of live their lives on their phone to avoid those things.
Absolutely. It's another thing the pandemic made worse. When we were in lockdown, reliance on our phones and on our devices, and actually getting out there in public and talking to real people, real faces, eye-to-eye contact. I think that kind of communication is still a very important human instinct.
Maria's on the chat says that 1 in 5 people are directly or indirectly affected by gambling. So clearly another addiction that's causing a lot of problems. One of the things we discovered when we were working on it is around 600 suicides in the UK every year can be linked to gambling. So that suddenly becomes one of the big causes of suicide.
Absolutely, and you know, the charity Gamble Aware do great work, but their budget for looking after people who are harmed by gambling is minuscule compared to the amount of money spent on advertising by gambling companies and organisations. So it's a bit like David and Goliath, and we're constantly exposed to gambling in one form or another. It's very prevalent, whether it's a national lottery, quiz, you know, it's still gambling, and people do get addicted to it, and it can be very harmful.
It feels to me, I don't know what you think, that we're a bit like we were with tobacco in the 1990s, that when the tobacco industry was still denying that nicotine was addictive, despite the fact that, you know, 40 years of research had suggested the otherwise. And we're kind of there with gambling. The industry is kind of denying that there's a problem with their products and the way that they're marketed and stuff.
Yeah. Yeah, I'm a bit cynical about it. I mean, you can have these last minute sort of warnings at the end of an advert saying do it responsibly, but it's lip service, isn't it? Because a lot of people can't, if they're addicted, do that thing responsibly. You know, it's really lip service to what is seen to be required, but it's not enough.
The slogan "when the fun stops" really annoys me, because if you're a young person who hasn't gambled at all, you see this and you think, oh, well, this is something that's fun, and it's also something that I can stop. So it seems that actually it's marketing disguised as a health warning.
Well, exactly. I mean, probably by law it has to come with some kind of health warning, but how effective is that really?
Yeah.
You know, and you know, I think we need to do a lot more to warn people about how easy it is to slip into dependence and addiction on anything. We've
moved into mental health, I think, and we're getting quite a lot of interesting questions about that. So first one I'll read you, Hilary. What is the opinion, your opinion on mental health checks? So we talked about physical health checks, particularly as men have less tendency to discuss this problem. Should this form part of the general men's health check? So when we go in for our health check, should we be asked about this stuff?
Oh, of course. I mean, it is absolutely the case that GPs are really pushed for time in their consultations. I think the average time is still about 7 minutes per patient, barely enough time for the patient to come in and tell us what they're complaining of. But, you know, ideally, your family doctor would be able to say, well, how are you? And tell me about your lifestyle. Tell me about your job, how things at home. Tell me about any worries you have. How do you sleep? What's your diet like? There you go. 7 minutes has gone already, and they haven't even told you what the problem is. If we don't understand our patients, if we don't look after them holistically, how can we hope to make them feel better and be better, physically as well as mentally? So I think absolutely it would be good to talk to our patients more about their feelings, their emotions, what's going on in their life, and be able to guide them that way. I mean, everyone's orientated towards physical health, but mental health is a major problem now, and worse since the pandemic, with far too little resources to help people. But hopefully there are people out there who can help. I mean, obviously talk to somebody you trust, first of all. Maybe it's a family member or a friend. And then, of course, there are healthcare professional services to call on if people think you should go and see them. And I would encourage that.
I think, I mean, I'm aware because of the work that I do of this 7 minute statistic about how short an amount of time, you know, the GP has got with you. And that plays on my mind because I don't want to waste your time. And I think that is one of the reasons why men are relaxed. We know you're incredibly busy, and you know, we don't want to be a burden on the NHS, because that doesn't feel like a manly thing to do.
And I understand that, but it's also important to realise that as an individual, you're just as important as everybody else, and that prevention is better than suffering from an illness which is developing. So you're actually saving the doctor's time in the long run, and you're helping yourself and everybody around you. Yeah, so remember that there are resources other than your GP. There are counsellors, there are mental health apps on the NHS, there are self-help books, many of which are very good, very well written. So avail yourselves, find out. Information is empowerment, and knowledge is good. So, read around the subject. You're certainly not alone. We're talking about millions of people who are probably suffering the same emotions and hardships as you might be. So remember that and get all the help you can.
So related to that, Hilary, question from Luke: do you think that too many men are prescribed medication to deal with mental health problems before looking at some of the root causes? What can be done to improve the mental health mechanisms within the NHS?
Yeah, I certainly we shouldn't be relying on medicines and handing them out without knowing more about the root cause of the problem. So, for example, if someone has a reactive depression, if someone is bereaved, and because of the bereavement they're not sleeping, and they're feeling anxious, and their appetite has been lost, antidepressants may not be appropriate at all. There's a reason for the depression which you can identify. Treat the reason, treat the underlying cause. So bereavement counselling might be much more effective than just giving someone a pill to take, knowing that there might be side effects. Identify the root cause, and then look at that rather than just relying on pills. The problem is that with so few resources, so few people looking after people's mental health, and waiting lists being at an all-time high for every age group, and people having to travel hundreds of miles to see a counsellor, even if they're severely depressed, for example. The tendency is to reach for the pill because it's easier, but it's not the answer.
So what can the NHS do to deal with that more effectively? Because as you say, you can prescribe the pill, but you can't necessarily prescribe bereavement counselling. It's not there.
What the GP can do is undertake some of that themselves. So if somebody needs a double appointment because they're pathologically bereaved, they need a double appointment, and GPs have the discretion to say, let's have a double appointment, let's see you again next week. GPs have that capacity to say, I need to see you again quite soon, let's talk it through. The other thing is to recruit to make a plan. So who can they share their feelings with? Which books are good to read? Which mental health apps could they go to? There are some excellent mental health charities that have self-help groups. They have chat groups that you can share with and get the reassurance that other people are in the same boat. And there are charities who have helplines that you can talk to somebody 24/7. So make sure you know about those and use them.
I mean, those are all really, you're right, all those things are incredibly useful. I just wondering what the NHS can do to be better here. We've often talked about parity between mental health and physical health, but I think it's fair to say we're a long way away from that. We
are, Jim. It's still seen as the poor relation to physical health for some reason, and the two things go hand in hand. So I would like to see more counsellors. I would like to see more mental health beds, things like postnatal depression, things like anorexia nervosa, of which 10 to 15% of patients with those eating disorders now are men, and that number's increasing. Yeah, we need far more resources, just as we need to train more doctors and nurses generally, and have more bed capacity in the NHS. But that means a commitment from government to spend more money.
Is that the only real solution? Is spending more money rather than reorganising what we've already got?
I think the NHS is pretty efficient already, and I mean we run beds at 95 to 98% capacity in hospitals. There's no spare capacity at all. So, we're not building enough new hospitals. We're not recruiting enough new. Well, there are plenty of people who want to be doctors who can't get the training. There aren't enough training spaces. Now, that's something that we've been talking about for years. So that needs to change. And we need to encourage people to go into nursing. Why are why have we taken away that bursary that used to give them training that enabled them to come into nursing without huge debts? We need to look after our staff better, and we need to stop messing around with all sorts of gimmicks that are seen to be a potential answer to the problem, whereas what we really need are more doctors and nurses.
Yeah, absolutely. I couldn't agree more from the work that I've done in this area. Absolutely. Men's Health Week this year is focusing on men's health and the internet, and I've talked about those online addictions which have been fueled by it. But can we talk a little bit more about the impact that you think the internet is having on men's health? I mean, it's a good thing that we can look up our symptoms, but maybe a bad thing because what we find might not necessarily be the most useful information.
Yeah, I mean, Dr. Google is a double-edged sword. As I say, knowledge is empowerment. But if the information is incorrect, it can be very damaging. There are some reputable sites on the internet, such as the NHS website, and you can rely on that. But there are also some sites which are less than reputable and quite damaging. If you look up, for example, the causes of headache, and the first thing you see is brain tumor, it's going to worry people enormously. Whereas the number of people with headaches who have brain tumors is a tiny proportion, right down at the bottom of the list. So it's about keeping things in perspective. I'm all for people getting information on the internet, but it still has to be interpreted. And I think find out as much as you can, but then take what you've learned to a healthcare professional who can put it in perspective for you. Most headaches are not caused by anything sinister, far from it. But finding out about the causes of fatigue might point you in the right direction and give you a heads up as to what might be causing that and what you might be able to do about it. But you've got to research very carefully, and increasingly I'm aware of people coming to me saying, "Oh, I saw this on the internet, should I be worried?" And usually I say absolutely not, because what they haven't explained is this or that.
There are other people as well that people can go and seek help from. I saw a piece of research showing that men are far less likely to ask pharmacists for health information than women.
Yes, and pharmacists do a great job. They're increasingly doing things that were once the province solely of GPs, such as taking blood pressures and checking cholesterol levels, doing earwax removal, and that's great. But I think we need to remember they can't do everything. They're not trained to diagnose as doctors are. I'm not in favour of them being asked to hand out antibiotics, as they've recently been asked to do. I think that is a potentially big problem. I do respect their qualifications and their long training and the work they do, and we work hand in hand with them. But I think there are sort of frontiers as to what we should each be doing.
What are the problems, do you think, with them sort of taking on more responsibility, such as prescribing antibiotics?
Well, we face a real problem with microbial resistance to antibiotics. So increasingly, we're seeing superbugs that don't respond to the antibiotics we have. And if we're handing out antibiotics inappropriately and willy-nilly for things like sore throats and coughs, which aren't significant, we are going to increase that risk of antimicrobial resistance, which we really don't want. So people will put a lot of pressure on the doctor or the pharmacist to prescribe them where they're not appropriate. And I think we need to use our time to educate patients that in the vast majority of sore throats, for example, an antibiotic is not going to make any difference, and it's not going to be appropriate and can cause side effects. So asking pharmacists to do this in a pharmacy outside of a medical clinic, I don't think that's appropriate.
Yeah. So, I mean, that's almost impossible to have a conversation like that, I would think, over the counter. I mean, some pharmacists obviously have a separate room, don't they? But very difficult.
Yeah,
Otherwise.
but still, I mean, pharmacists don't have any training in physical examination.
Yeah.
And sometimes, you need to look in that child's ear. You need to look in that adult's throat, or examine a rash they have, or listen to their chest. And as far as I know, pharmacists are not trained to do that.
Go back to get to something we were talking about earlier, which is I was talking to a urologist yesterday, a European urologist, and he was saying that the EU are about to introduce, I think it's only at the level of trials at this stage, but prostate cancer screening based on an initial PSA test, but with a series of stages that you would then go through, including scans and biopsies in certain cases, and that they think that they've got this kind of algorithm which will enable us to start doing proper prostate cancer screening. What do you think about that?
That's a great question, and I'm going to answer it as I move, because we've had those technical problems today.
Yes.
My battery is running out. I need to connect to the power supply. I'm going to move, but I'm going to keep talking as I do it.
Okay.
So just bear with me. This is what they call, well, it's like live TV, isn't it?
It is live on Facebook and various other places.
Absolutely. You're going to get a little tour of the ITV back rooms.
Oh,
Thank
fantastic.
you very much.
Yeah.
Can I get into the restroom here as well?
So just bear with us, everybody.
I'll be answering that question.
Hilary finds his dressing room.
Oh, yeah, it's open, yeah. I know, this is great fun, isn't it? This is what my life's like.
And this gives you an opportunity to come up with some interesting questions to put in the chat. We'll be moving on to those very shortly.
Absolutely. Well, as you know, with prostate screening is by no means a refined state-of-the-art science. PSA is the blood test we do to measure something called prostate-specific antigen. The problem with this is it can often suggest that there is a problem when there isn't, and it can often miss a problem when there is one. So it has led to people being misdiagnosed wrongly with prostate cancer, and it has missed some cancers. So it's certainly not an ideal screening test. Some screening tests are much better than that. And specialists do worry that it can sometimes do more harm than good. Too many investigations, too many biopsies being done, too many MRI scans being done unnecessarily, too much worry being engendered. Now, we're looking to improve the prostate screening test all the time. And you're right that recently at a urologist's meeting, they have found that by measuring other parameters, two sorts of PSA, what they call bound prostate-specific antigen and free PSA, so some bound to protein in the blood, some not bound, and other biomarkers, they are able to look at an algorithm and say, this is a much more accurate test. We're not misdiagnosing so much. We're much more accurate. So the one that I heard about was called Stockholm 3. It's not generally available at the current time. It's something that's being looked at. It should be able to refine diagnosis and screening. Obviously, there's going to be a cost implication. We are getting better at looking for prostate cancer early by doing MRI scans, doing biopsies, and treating patients accordingly. But we've still got a long way to go.
The worry for this particular urologist was even when they started doing this in some parts of Sweden, only half of men, were presenting, even though they were invited to go and have a check. Only half of them were turning up, compared to 90% plus of women who turn up for breast cancer screening.
Yes, that's right. I mean, some men still have this attitude that they don't want to know. Um, Sometimes they're more frightened of the treatment than they are of the condition.
Yeah,
So they may have read about something that puts the fear of God into them. They may have read that, you know, you have to take hormones that will change you into women. You'll grow breasts and all side effects will happen. They may have read that you know, the biopsy is a nasty thing to have. And some don't even want to have that digital rectal examination, which by which the doctor can tell on with their gloved finger whether the prostate gland is enlarged or the texture has changed. I mean, the fuss men make about something as simple as that, you know, they've got nothing to compare to women, what women have to go through. And yet they'll put this off thinking it's some sort of, you know, it's a form of GBH. You know, culturally, it's really interesting. In the United States, where people are much more interested in medical screening and they value medicine more because they have to pay for it. It's personal opinion. You know, if you don't do that rectal examination on a man, you're almost negligent. But here in this country, if you do it, they think it's GBH. So we have to get over this thing that it's an invasion of your privacy. I'm moving again, but not far. I'm just shutting the door this time. What must you think of me? So we need to first of all get over this reluctance that men have to go and be sorted out. We need them to talk about their symptoms. So, common symptoms, as you know, are a difficulty peeing, a weaker stream of urine, having to go more often, having to go urgently sometimes, and blood in the urine. Those are the common symptoms. But 9 out of 10 of those people will not have prostate cancer; they'll just have a benign enlargement. But
yeah.
until you get it sorted out, you don't know. So yes, so the PSA test, that was your original question. We need to refine it, and hopefully, in the next few years, we will have a better test, a more accurate test that will be able to diagnose the real thing accurately and spare men from investigations they don't need, where they don't have prostate cancer.
I've had a digital rectal examination, so I've had one of your colleagues stick his finger up my bottom. I'm imagining that you possibly have as well, given your age. I mean, I certainly
Yeah.
wouldn't you know, it's absolutely nothing to be frightened of at all.
Not
I think something that maybe men are frightened of is that in the past, surgery on your prostate would often lead to erectile dysfunction afterwards. But that's not the case now, is it? There's nerve sparing surgery, which means you can have
yeah.
prostate surgery and still have a perfectly happy sex life afterwards.
Yeah, so we have robotic prostatic surgery where it's needed. So that's likely to be more precise, and spare the nerves which are necessary for erection. We have choices of therapy. We have radiotherapy, brachytherapy, where radioactive needles are put into the prostate rather than external radiation. We have hormonal treatment, and then of course in those reducing numbers of cases where there is an effect on erectile function, you know, there are aids to erection which are very effective, be they medical or surgical. So that side effect is much less of an issue than it used to be.
Yeah, absolutely. So you would encourage any man with those symptoms that you described to go and see their GP.
Yeah, absolutely. I mean, there's a phrase in medicine, which is if you don't put your finger in it, you put your foot in it. So get that rectal examination done so you don't miss something that could take your life. It's just very simple to do. Once you've summoned up the courage to do it, and you look back, you think, well, what was all the fuss about? I went to the doctor, I was in the waiting room for 5 minutes, and I was actually in the surgery for 4 minutes. He did the test, and now I've got the result. The PSA is normal. My prostate is normal size and normal consistency. I'm reassured. You know, it's something that probably every man over 50 should be doing, and every man with a family history, or any black man, because they're more prone to it, should be doing after the age of 40 on a regular basis. That's something like every 2-3 years.
we're talking now about the symptoms of prostate cancer. Obviously, that's one of the big three killers, I think, of men in terms of cancer. The other two are bowel and lung cancer, I think. So perhaps we should just quickly rattle through the symptoms that you might notice for those.
Yes, certainly with lung cancer, it is going to be hemoptysis, coughing up blood. So if you cough up any blood, and particularly if you're a smoker, then it's important to get that checked out. Go and see the doctor, have a listen to your chest, organise a chest X-ray, and follow up on any further episodes of coughing up blood. That's important, and the smoking history is really important. With colon cancer, as we know, if you're a certain age, you will be sent an NHS screening kit, which measures any hidden blood in your motion. It's a one-off test. It's very easy to do at home, and then you just send that tiny sample off in the post to be analysed, and they use immunofluorescent tests to look for this blood, which can be the first sign of hidden colon cancer that you might not be aware of. Colon cancer, one of the commonest cancers in both men and women. And now often the blood won't be anything sinister. It'll be coming from hemorrhoids or a polyp, whatever. But you mustn't ignore it. We had Dame Deborah on our programme, who tragically lost her life at a young age from colon cancer. So it can happen to young people as well. Other signs would be, apart from blood in the urine, would be a changed bowel habit. So what is normal for you suddenly changes to either being more frequent, or you're constipated for more than 3 weeks with no explanation. Bloating of the abdomen, or a lump in the tummy, fatigue, changed appetite. Again, these things need an explanation if it's not immediately obvious. And again, it's an area where we must get over that initial embarrassment. Some people have this Victorian idea that your bowels are dirty. Your bowels are actually, without your bowels you couldn't live. Without those healthy bugs you couldn't absorb vitamins. You wouldn't be able to digest food. So our gut is closely related to our immune system. 90% of our immune system emanates from healthy function in our gut. We need to look after our gut. When you think of what we put down our throats and expect our gut to contend with, it's amazing that we don't have more problems with indigestion and colitis and all sorts. But yeah, be aware of your bowel habit. If it changes, go and get it sorted.
Are you a fan of fermented foods and things like that for gut health?
Well, luckily, I was blessed with a gut that usually looks after itself. So I do have a healthy diet. I eat a lot of fruit and veg, and not too much rubbish. And I think exercise is a great way of regulating your gut health as well. What I would say that I don't think colonic irrigation I'm not a fan of. We don't need to wash out our bowels. As I say, it's not dirty. We need those healthy bacteria to function normally. So there are two schools of thought, aren't there, in this country? We either think our bowels are a huge joke and they're a great source of amusement to many men, or we don't talk about them at all. But probably somewhere in between is a good middle road.
Yeah, you made a really interesting point earlier, just in passing, really. But you said that the Americans tend to value health care because they have to pay for it. And I was just wondering what you think we can do to get British men to value healthcare without having to pay for it, because I don't think any of us want to go down that road.
Well, I mean, there was an excellent book written by A.J. Cronin called The Citadel, just before the NHS came into fruition in 1948, and he describes what went on before we had an NHS. And poor people simply didn't have any access to healthcare, so children died. Poor children died of infections which could have been treated. No access to hospital, and people were desperate for healthcare for all. So the NHS, when it was first brought out, was the most wonderful thing that happened after the Second World War, to reward the people who fought in that conflagration, and everybody appreciated it, and it did wonderful things. Funnily enough, 9/10 of doctors were against it because they wanted to hang on to their power, their private clinics, so that they didn't want to be servants of the state. And for many, many years, it was a most wonderful thing, and it still is, of course, in many instances. But when I see in A&E departments the abuse that the staff get because people are waiting more than a few minutes, the abuse they get when they're not totally satisfied with this or that treatment, it really upsets me, because people don't realise what they're getting for their money. They don't realise what excellent healthcare they're getting for very little. And if you look around the world at what goes on, people would be feeling grateful for what we have, and we need to cherish it and look after it, because without it, we'll be really stuck.
Do you think that that's an issue for education? Maybe people don't really learn that the value of what it is that the NHS provides for them.
I do think that. I do think that people don't understand how it really works. We don't understand. I'll give an example. We had a debate on our ITV show about the number of people going to A&E on a Friday or a Saturday night who are under the influence of alcohol and are abusive. And have got into fights, etc. Some A&E departments, 85% of their intake on a Friday or Saturday night is needing to look after these kind of clients. Now, it was suggested that we should fine them. We should fine them £10, £20 if they're found guilty of abusing the health service in this way. But I explained that's a drop in the ocean. So our responsibility as doctors and nurses looking after a patient who comes in worse for wear is, first of all, we have to make sure it's alcohol that's causing them to be semi-comatose and vomiting. We have to make sure they're not, for example, in a diabetic coma, or that they haven't got a meningitis. We need to know that it's alcohol, and that means a blood test. It means admitting them, maybe pumping a stomach. But a hospital bed is taken up. It takes a nurse in triage, and then another nurse to assess, and then a doctor to assess. You need to write all those notes down. It needs to be recorded. You're probably talking £1,500 for each patient, not a tenner. And most people think they think it's going to cost a tenner. But it's not as simple as that, because each patient we see is a huge responsibility. We're looking after them. We're looking after their life. If we make a mistake, we get sued. And that's why we need a kind of education to get people to realise just how responsible and effective and economical the NHS is, and we need to cherish it.
No, I absolutely agree, 100%. I mean, you mentioned there about the example of someone turning up worse for wear. I mean, is the solution to that minimum alcohol unit pricing rather than £10 charge for turning up pissed at A&E?
Yeah, well, exactly. I mean, I think it's been tried in Scotland, and with mixed results. I think the trouble is, if you make alcohol more expensive, the only clients you'll get in A&E would be the rich ones. So I think it's important to educate people. That this culture we have of imbibing far too much far too quickly is very prevalent now. And then, as well as your binge drinkers on Fridays and Saturdays, you've got your middle class constant drinkers at home during the week. And there's no doubt that we're seeing much more alcoholic liver disease now than even we did 2-3 years ago. So this is to coin a phrase, a brewing problem.
Yeah, thanks very much, Hilary. We're coming to the end of our time now. We've had an hour. Thank you very, very much indeed for your time. I've really enjoyed talking to you about this, and I hope everybody out there who's been following and the Virtual Village Hall or on Facebook or whatever has enjoyed it too. You'll find all of the Men's Health Week sessions on YouTube, including this one, and the Virtual Village Hall website. You just have to search at Virtual Village Hall, all one word. Thanks very much for listening to us, everybody. Thank you, Dr. Hilary.